Hey, Kathleen here. So I'm going to talk about how I reduced swelling fast after jaw surgery, which I had January 13th, which is 3 weeks ago. So please bear with me as I go through this video. A lot to talk about. So if you've had jaw surgery, facial surgery, airway surgery, or even major dental expansion, you probably already know the swelling can feel endless. For me, swelling wasn't as troublesome as I know it's been for some others. In the jaw surgery Facebook group I'm in, I've seen crazy photos and read how people feel like their face and or lips are going to split apart. This can greatly affect breathing, sleep, energy, and mental state. So in this video, I want to share the real world recovery protocol I personally used to help reduce swelling fast and heal more comfortably after double jaw surgery and septoplasty. Now, this is not medical advice. It's simply what worked for me as a patient who became slightly obsessed with healing as efficiently as possible. If you're on your own recovery journey, I hope this gives you some practical tools you can try for yourself. So, one thing I learned is that swelling isn't just about trauma, it's about lymphatic flow, inflammation, circulation, and overall metabolic health. I actually learned this before my surgery and crafted a plan before my surgery. So instead of focusing on just one solution, I built a layered healing protocol. None of these alone are magic, but together I believe they are what made a dramatic difference. Now, before I share the 7 layers in my healing protocol, I do want to preface that my surgeon was incredible, and his surgical techniques often help his patients have lower swelling. He also had me on a corticosteroid for reducing inflammation for 6 days once I was home from the hospital. So, while I'm not mentioning these in my healing protocol, I do want you to be aware of these significant factors. I'm going to list my healing protocol in the order that I started each in my recovery. So, number one, I have to say that this is the most important place to start and might be one of the most overlooked parts of surgical recovery. There are some surgeons who actually recommend this to their patients for the 2 weeks prior to surgery. What is it? Anti-inflammatory eating, which focuses on fiber-rich vegetables and fruits, nuts, seeds, fatty fish, and olive oil while avoiding processed foods, refined sugars, and trans fats. So prior to and during healing, I focused on clean, anti-inflammatory eating. And while I don't do everything right, I made significant improvements, especially beforehand, including gluten-free, dairy-free, very low alcohol, mainly organic, supplements, and fish oils. So food either feeds inflammation or fights it. And I honestly believe this was the number one layer in my healing protocol for keeping inflammation and swelling down once I finished the corticosteroid. This is in addition to keeping a high protein diet and keeping calories up during recovery. I was able to eat the actual day post surgery in the hospital, one Ensure and a bowl of soup. I pretty much forced myself because I knew nutrition every day would have a huge impact on healing and recovery and keep me out of the emergency room. And while this wasn't necessarily really clean eating, it was what I was given in the hospital. So I ate high protein, high nutrition hospital food for the 2 days and nights I was in the hospital. You can see by my photos my progress to where I am today. Healing is metabolically demanding, and I truly believe that giving your body clean fuel with high protein matters far more than most people realize. The second layer is supplements before and after surgery. Surgeons ask you to go off most medications, vitamins, and herbal supplements 2 weeks prior to surgery, primarily to reduce the risk of excessive bleeding, prevent dangerous interactions with anesthesia, and ensure cardiovascular stability. Since I take quite a few supplements and herbals normally, I did some research on ones that my surgeon might allow me to continue taking that wouldn't be risky. He approved me to continue right up to the day before surgery on vitamin D, vitamin C, Bs, and a urinary tract supplement. But please do not take this as medical advice. There are many restrictions, so check with your own surgeon specifically. Once surgery was complete, I had a pill crusher and was able to continue with these until my surgeon allowed me to return to my normal supplementation. There are some supplements that may help reduce inflammation that I added in at different times in the first few weeks. Again, not medical advice, just part of my personal recovery stack. These include vitamin D, which I never stopped taking, omega-3 fatty acids, curcumin, also known as turmeric, bromelain, and the homeopathic Arnica montana. Arnica montana and bromelain are known to help reduce bruising and swelling. These are commonly used after cosmetic and dental surgery. I mainly use the homeopathic arnica gel on my face, still do, but occasionally took the arnica pellets under the tongue. And bromelain, which is derived from the stem and fruit of the pineapple plant, was added in once I was able to swallow pills again after week 2. That's when I started taking curcumin and omega-3 fatty acids as well as part of my regular supplements. Moving on to movement, walking, the most underrated tool, and it's the easiest healing activity for most people. And I'm sure that you're doing it. Gentle walking activates the lymphatic system, improves circulation, and helps your body move excess fluid out of the face and neck. It also helps rid waste and toxins from tissues. Since my surgery was mid-January, I used the short track upstairs in the workout area at our community rec center, which has been a godsend. Somehow, I was able to start with a total of 4,000 steps a day, but some days it's just been 1,000 to 2,000. Even short walks can make a noticeable difference. This is especially important because when we're resting a lot, lymphatic flow stagnates, and that leads directly to persistent swelling. Walking also helps sleep quality and digestion, which indirectly helps healing. But this is critical. I didn't let step count drive me. I read my body, how well I slept, and allowed lighter days when needed. Otherwise, I made sure I got out and walked. Number 5, lymphatic drainage massage. This was huge and actually is really easy. Swelling is largely a lymphatic issue, and gentle lymphatic drainage massage made an immediate difference for me. The goal is not deep tissue pressure, it's a light directional movement that encourages fluid to drain down toward the neck and collarbone. Even a few minutes of gentle massage noticeably reduced facial tightness and pressure. And it's really so easy to do. I'll link the lymphatic drainage YouTube video that I use as part of my daily routine in the description. Now, number 6, red light therapy. You've probably heard about it. It's a little bit confusing. Do you use a panel? Do you use a mask? And I'm not here to solve all of that. I just want to tell you that red light therapy did quickly become part of my recovery routine. I not only purchased a small red light little panel from Amazon, which I link in the description, but my community rec center actually has a recovery room with a huge red light wall in it. I don't know how we got so lucky, but red and near infrared light are known to support cellular energy, tissue repair, and healing. So this is something I use gently and regularly, about every other day, on my jaw, neck, and face to help reduce inflammation and improve circulation. I recommend you research this a bit yourself so you can decide what's the best approach for you. You can also find a lot of discussion on this topic in the Jaw Surgery Support Facebook group. And finally, the last powerful tool I use is a vibration plate. This is not something most people have, but I've been using one at my chiropractor's office for over a decade. So I gifted one to myself a couple of years ago. Vibration helps stimulate lymphatic drainage and circulation without requiring intense movement. I didn't expect I'd ever be able to use it again due to the screws and plates in my face. But when my surgeon cleared me to use this as long as it wasn't jarring my jaw, I was ecstatic. I use it gently in short sessions in the morning and at night. Again, this is something you'll want to research so you can decide what's best for you. Now, why does this combination matter? Each of these 7 healing elements has power in and of itself, but together, they've created a powerful healing environment stacked for my body. Even if you don't have all of these elements, the key is consistency and stacking small advantages with what you have or what you're willing to add on. Healing is cumulative. So if you're recovering from jaw surgery, airway surgery, or any major facial procedure, I hope this gives you some practical tools to help reduce swelling and heal more comfortably. If this video helped you, I'd love for you to give it a thumbs up, subscribe, and drop a comment below with what helped you most during your recovery. Your experience could help someone else immensely.